Joel, if you can hear us, that'd be good. We can't see you right now, but can we start the meeting?
Sure.
Okay. Here's name coming up.
Yeah,
All right.
you hear me, right?
Can we do the Pledge of Allegiance?
Sure.
Everybody rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right. Now we have a couple of businesses that we have to take care of here. We had 2 meetings. We have to okay the minutes for those meetings. Now let's start with the March 30th, 7 p.m. meeting. Does anybody have any questions, comments, anything they want to ask about, talk about, whatever?
Nope.
Okay, if nothing, then maybe someone would like a motion to accept the minutes as stand.
I'll make a motion.
All right, well, I'll second it.
Okay, still no comments. Let's vote on it. All in favor, say aye.
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 Opposed, abstained. Okay, motion's passed. Let's go with April 9th. That was our special meeting. Does anybody have any comments, questions? Anything they want to talk about? Okay, let's again, if someone wants to put in a motion to accept those minutes as stand. Somebody?
I'll make a motion to approve the minutes from the special meeting.
Okay, and any comments, questions? Nothing? Okay, let's vote on it. Everybody in favor say aye. Aye. Anybody opposed? Abstain.
I have to abstain. Abstain.
Who abstained?
Jeff.
Jeff. Okay, Jeff abstained.
Wait, so then can we, does the vote count if there's only 4 and only 3 voting? Because Jeff wasn't there?
No, it doesn't. We need a quorum.
Oh, he's abstaining. Oh.
Because he wasn't there. We can defer. Do we defer these minutes till?
Yeah, defer until next month.
We're going to have to.
Or when Shay arrives at approximately 7:21. My best guess. All right, it's just my best guess.
All right, let's defer on that one until we get another person to come in. Oh, there's Shay.
We'll circle back.
He's on.
He is.
Yeah, I was going to go 7-Eleven until I saw it.
Hi, Shay.
Hello.
Okay, Shay, we're just voting on the minutes for the April 9th special meeting.
Yep, noted.
Do you have any comments or questions or anything you want to say about it?
Nothing at all, just read them, so we're good.
Okay, then let's try the vote again, motion again. Someone want to make a motion to accept them?
I'll make the motion.
Okay, seconded by?
I'll second.
Okay, all in favor?
Aye.
Aye. Anybody opposed or abstained?
I abstain.
Jeff abstained. Okay, thank you.
He has to be Mr. Perfect, I tell you.
But motion passed. Okay, saved on that one. All right, let's get into tonight's agenda. Public comment. Anybody have any public? No public. Okay. Past minutes. We did that. Chief report. You're up, Lee.
All right. COVID-19 is going as can be expected. We have now over 200 confirmed positive transports. We have tested over 650 either town of Trumbull employees or community members for COVID-19. And we have assisted at 100% of the town's vaccine clinics and homebound clinics and assisted with them in their delivery of over 9,500 vaccines to date. We're counting down to 10,000, and I know we did a whole lot more today that are not included in that number. It's going really well. We've had a very positive amount of people that are willing to give up their time and stay involved in that. As you know, the governor and the state and the CDC are about to finalize their rollback guidelines. And we're all beginning to see already what we saw the last time this happened is that just by talking about us opening things up on around the 19th, people are starting to act as if those changes are already in play. Certainly, we're seeing a lot more people that seem less compliant and more willing to, I guess, be out there in big crowds. So I guess time will tell how we go, but we will continue to obviously advocate for everybody to maintain vigilance, to certainly wear their masks at all times, and try to get the positive messaging out on the vaccine clinics that people can be attending right now. From a staffing perspective, all our new employees have onboarded and are doing really well. The big news for us is that our supervisor, Sunny, will be looking to resign with a final date of August 1st. If you remember, this isn't a surprise. He was in paramedic school, remember, and when we were interviewing him, there was a lot of discussion about how long he would be willing to take the position for. But based on the candidates that we had, he was certainly the strongest candidate, and the decision was made that it was better to onboard him and have him help set up the program and the staffing with someone who knows us and knew where we were, and then look to hire somebody else once he was ready to move on as a paramedic, and hopefully with a longer lead time, which is exactly what he's given us. I'm sure you remember we had quite a short lead time to recruit and do the hiring for our department, whereas now we hopefully should be able to post his position almost immediately, because it's just a repost of a position that we've already written and established, which gives us 3 months to recruit, advertise, accept those applications, review them, and interview and get somebody strong through that onboarding process. The positive news is even when we were interviewing, we had a lot of strong candidates that hadn't put their application in because it was the position was posted for such a short time that they expressed a lot of interest in the position. So I do think we will see some strong candidates putting in for that. And Sunny continues to do a great job. We've been putting together this working document of the administrative roles, responsibilities, and guidelines, and it's really a playbook so that on any given day, if one of us isn't here, people know exactly what the roles and responsibilities are and where to find it. And he is continuing to work on that. So hopefully when we do onboard his replacement, it will be quite a smooth and easy transition. So that's the big news. And he did come and talk to me about that just before I left for my vacation, and then send me his official resignation.
Couldn't wait till
No, I didn't hear you, Joel.
Oh, couldn't wait till he got back?
No, nope, got the letter. So, but I think it's good, and I think he will certainly be willing to onboard and train the new employee. He said he would stay on as a per diem EMT, which is great for us because it allows us the opportunity to, if needed, have him step in every once in a while as a per diem standby supervisor. Obviously, I'm sure he would want to be working as a per diem paramedic eventually, but we talked about that fact that he would need to get some experience under his belt and apply for that role. But if he wanted to, in the meantime, just pick up 1 or 2 shifts here and there as an EMT, just to keep his foot in the door and stay with us, it seemed like a good idea. So he's very open to that. Moving down to Thames Pace, we graduated our EMT winter class with a small graduation ceremony last week. It was a bit of, it was a challenging group of students, but our faculty did a phenomenal job in, I guess, student wrangling, which we don't normally have to do. But they did a really great job. We will be getting some volunteers out of this class, at least 2 local Trumbull ones, both those 2 are the 2 who won the award for excellence. Wendy and Victor, Victor is a high school student. Wendy is a more mature female, and both of them were just incredibly strong students and very dedicated. I think would be a great fit for Trumbull, and both have expressed the desire to want to volunteer here and get their state certification as soon as possible. So that's very exciting. Summer EMT program currently has 17 participants registered with 7 confirmed payments, a couple of them in full. So I anticipate that class will be a very full class. I haven't finalized my cutoff yet. I'm still waiting to assess the COVID situation, but ultimately I can't see myself doing more than 20. 25 would be a max, but honestly, I think 20 is a safer option. Just allows us to, if we do see any type of surge where we need to shut things down, we can still safely, run the program and use all our kind of safety strategies. So in addition to that, I'm excited that we are currently set up to host a custom request for Sacred Heart University's Department of Public Safety. They asked us to run an EMR class for them. We just graduated one of their employees from our EMT program. And then they had asked if, because I guess it's a job requirement for them to either hold an EMR or EMT. They have traditionally held a relationship with AMR's education program, but they came to us because AMR had been unable to accommodate their needs and they were looking at other options. So this is just a trial class right now, but if it works out positively, I think it might be a great addition to our clinical education program. It's great. These guys are committed students. It's guaranteed revenue that's going to come in from obviously the university. And all of these students are very motivated to be in the class and pass the program because they need it to keep their jobs. So we're excited. We're dealing with them and they're very excited to have us on board. And our instructor, Jackie, has taken this on. She's written an entire curriculum and handbooks and everything, and they've already received that. So we'll let you know how it goes in a couple of months. Clinical education, we're doing what we're doing. We're doing a big push right now in mental health. So we're offering QPR classes, which are being funded through some grant funding from some of our community partners, such as the Hub, Connecticut, RISAP, TPOD, which is really, really good. We're also going to be sending a couple of people to do assist suicide prevention training and some other peer prevention programs so that we can expand what we offer in mental health, not only to the community, but also to ourselves and within the industry. So very, very excited about all the work that's going on there. We also have a few of our employees, including pretty much the entire administrative team, completing their ACLS and PELS instructor requirements. I think tomorrow's class, we're all teaching a pediatric life support class for Bridgeport Hospital, and that will get us all certified. So going forward, we will be running those classes, I think, fairly frequently, not only for EMS providers, but I'm going to start offering them to some of our community partners, the medical practices that are local that have reached out to us in the past asking for assistance. So kind of excited about that. I think it'll be a nice way to, connect with the community and hopefully, a little bit of spare revenue for our special agency if we can do it cost effectively. Special ops, nothing too crazy this month, just a whole lot of IAP writing for vaccine clinics and our community pop-up. For those of you who weren't aware, we ran a post-spring break community pop-up clinic that I was pushing to set up. We did a really big Trumbull Slays COVID prevention push here within EMS. We asked all of the town departments to consider coming in and getting a test in the 2 weeks post-spring break, just a preventative test. We offered it to the Board of Ed, all the Board of Ed families. We offered it to parents of students, just really trying to get people to come in and acknowledge that spring break was a very high risk transmission week and that it was, erring on the side of caution. So the community clinic went so well. I think it was something we can do, and I have reached out to the town of Trumbull and offered it as an option to set up as a pre-prom, pre-graduation, pre-any large event if they want us to host a site similar to that, say 72 hours before the high school prom or high school graduation. If they want to have all attendees come in and test at one of those sites, I think it would just be like one extra step. So if you've got the negative test within 72 hours and or you're fully vaccinated, you're cleared to go to these, big events. Haven't heard back if anyone's going to take me up on that. And obviously with the guidelines changing, people aren't necessarily going to do it unless it's mandatory. So we'll see. Time will tell. But it was good, and very interestingly enough, on Saturday's pop-up clinic, 16% of the community tests came back as positive. Those 16% had acknowledged on their booking that they were either exposed to someone with confirmed COVID or someone had or confirmed travel. So interesting statistics. And I think, it served its purpose because hopefully all of those people are staying home and doing what they're supposed to do because they weren't symptomatic. That we do ask them to document if they're symptomatic or not symptomatic when they book, and they were asymptomatic. So it's doing its job, which is good. Call volume is creeping. I say that, cautiously creeping upwards, but we're still not where we would like to be or where we were pre the pandemic. 370 calls in March, 354 were transported. I am very proud to say that our mutual aid requests continues to decrease. So I think that our strategy with placing our supervisors here in the week to take those calls is working very well, as well as our team who are very much doing what they can to turn around. We still have the Trumbull EMS, I don't know if the word curse is right, where it's all or nothing. We sit around and don't do any calls, or we do 5 calls within an hour. So when that happens, even if we can't cover all of them, our on-duty crews are genuinely doing everything they can to safely transfer care to the ER and get themselves cleared and available to come and take calls. So on community front, I don't know if any of you were able to watch the screening of My Ascension, which was offered free. We were a community partner with one of the local groups called My Friend Abby, which was started by Gillian Anderson, whose daughter Abby took her own life by suicide a few years back here in Trumbull. And she has created this beautiful charity that sponsors youth suicide prevention. And this was a screening of a movie about a young cheerleader very similar to Abby, who attempted to take her own life but was unsuccessful and is now in a wheelchair. So it was her story. There was an excellent guest panel. Jessica Hesh, one of the American actresses that's local, an excellent doctor whose name I'm just blanking on right now. Some Olympic sports person. It was a very, very interesting, and it was very, very well attended, which we were really, really happy to see. We're providing Narcan trainings to senior center partners. We did a great presentation for one of our local special needs group homes. They were super excited. It was all about, how we can better assist them in their, when they call 911 and addressing, the things that might normally cause them to be stressed when we get there or to feel defensive in terms of the questions we're asking. So that was super popular. They asked if I could do it again, and they, wanted to keep the recordings and bring in other people. So that went really well. And Kate and I will be running Trumbull High School Saves Lives CPR event this Thursday and Friday with a few of our CPR instructors certifying as many Trumbull High School teachers and whoever they wanted to bring with in CPR. So we're excited to start getting back into the community. We will not be doing hands-only CPR in the middle schools this year. We did apply and they've asked for us to wait until the fall, and we completely understand the hesitation in just still opening up too much. So any which way we can, we're trying to get out there and safely connect. I just wanted to commend the COVID vaccine team. I put all their names there. These guys have been unbelievable. Certainly Maria Chapa, Barbara Kendall, and Bob Halebrand have attended every single one of our either COVID clinics or COVID PCR collection, and we have done so many of them. I mean, we were doing 5 days a week of PCR testing. Maria has run that. I can be out of town, out of the country, and it's quite a complex process, the PCR testing program. She handles that with grace. So really huge kudos to the teams that are helping out with all of this, because they're giving a lot of their time. Our new electronic healthcare recording system has rolled out. We're loving it. There's a lot of great analytics that we're going to start seeing. I'm going to share some of that with you hopefully next month. The QA side of it is fantastic. We're actually starting to be able to really revise our QA program, and we're going to start to be able to drill down and focus on areas that we really want to see improvement, even in areas where we think we're doing really, really well. But the analytics are showing us, just key focus points that we can work on doing even better. So very excited about that. Supervisor Weber has been a godsend. It's a huge project that he's undertaken. And QMC, I'm gonna do a screen share at the end of this. They gave us this fantastic patient portal for us to drill into our revenue analysis. And just looking at that and working with our new collections agency, we're starting to see some really positive trends with our billing practices. So I'm excited about that. Trying to get us to reopen the discussion about our patients being able to pay via credit card. It's a constant complaint I get. And interestingly enough, it's usually coming when we get people who have been sent to collections. And that's when I get the phone call and they come down and pay, and they also rant. That's a very polite version of what they have to say about how they would have paid it if I could have just simplified it by letting them pay by credit card, which in their defense, I agree. Their message delivery might be a little bit more polite, but I agree with the concept. These days, everything is electronic. The problem is that if we go with a credit card, we have to pay a fee, the 3 or 4% fee, which doesn't seem like a lot to the person paying their $250 bill, but to us, in our 1.4 million, the town doesn't want to pay the fee, the billing company doesn't want to absorb the fee, and that's where I've been in the middle dancing ever since. So I'm going to keep working on it. I'll keep you posted. So some statistics are there for you. So I'll quickly share my screen. Work out which screen to share. So you can see this. I'm going to show you like just the smallest thing on QBuy, only because this is a public meeting and a lot of the stuff that's in here is got patient demographics on it, so I can't really show it. But basically, the system like will allow us to really analyze like the calls by ALS, by BLS, the type of thing, the bundle billing by agency, the percentage of the net charges, the gross charges. It gives you like performance analysis at a glance. So when I look at this month by month, if I see a really big fluctuation, I can start to really drill into it. And I wish I could, I've got to figure it out a little bit more before I can share it on this public forum screen. But these ones over here, like they really allow you to like, you deep dive into say your Medicare, and it will actually break down like the Medicare by the different types of Medicare and the type of call and how the payments works. I think it's going to be really helpful for us in understanding some of the discrepancies that I find when I'm looking at the revenue, and I can't understand why I feel like it should be higher based on the Medicare rates. Like that kind of does it. So I'm going to try to put some graphs together for you that don't include, because a lot of these will come up because they're summary. It's listing the patient names, and I just don't want to share it here. But I just thought I'd give you a little taste of that. It's a really cool system. And then same thing here with ESO Suite. This is our new system. The guys check in over here. They do their PCRs here, and we can see the outcomes over here. Again, I can't click on it because it's all HIPAA, but right then and there, we get to look at what's going on at the hospital, what they found. So super helpful. And we're working on a couple of glitches there in terms of, reasons why sometimes we can't see it when we should. So that is all going really, really well. And since I'm sharing the screen, I'm just going to briefly skip ahead because then we can just knock it off to new business deployment pattern and mutual aid discussion. Really just a brief discussion for you guys to like start thinking about. I'm going to come back to you guys in the next couple of months with more details, but I'm trying to look at the analytics now that we've got this new software that's allowing us to get a much more accurate picture. I'm still seeing the same trends that I was seeing before the pandemic in terms of what time of day we're rolling these calls, the days of the week. So the reason this is important is because ideally I do want to change our deployment pattern, which is it's going to involve us bringing on more staff with more costs. But the data is supporting. So first and foremost, this is the month of February over here and March. So both times you can see that the ALS mutual aid is much higher than the BLS. So I think it was like 6 and 14, 6 BLS responses for mutual aid and 14 for ALS in February. And it was 7 BLS in March and 15 ALS in March. So the first thing that tells me is, we tend to need a lot more medic response. And I already know the reason why, because I've been looking at this unofficially since way back when. And it's about the time of the week. So what we're predominantly seeing is that between 4 p.m., when my second medic goes off, and 10 p.m., that's when we roll the most amount on average of calls. And a lot of those are medics. So for me, my goal would be to try to change, instead of having that second medic be on at 8 to 4, I would like to see them come on from 6 to 2, which is an 8-hour shift, and then 2 to 10, because the other time that we see a lot of consistent rolling of calls is between 6 to 8. So ultimately, if I do that this way, it will catch those calls. And the other thing it's going to do is, because our 24-hour medic runs on a 7-hour schedule and an 8-hour schedule, but starts at 7 a.m. So goes 7 to 3, 3 to 7. By having that second medic start at 6, we're also able to utilize them for what would be a late call for the 7 o'clock medic. So once again, we're going to start seeing a savings on overtime for those medics. So, I'm going to have lots and lots of notes for you guys to consider, for the finance board to consider. But I just thought I would show you kind of how I've been looking at it. For example, like the percentage rates by day and on overnight. So there's a lot of talk of, like, from that 11 p.m. until 6 a.m. That's when the police department feel like they're constantly covering our mutual aid, and everybody feels like we're rolling mutual aid. But when you actually look at the data, it's really not that high. Weekends, we see an increase, and that's because we have less paramedics on in general. So in the week, we have 3 cars on, and on the weekends, we only have 2. But ultimately, when I look at the numbers at the moment, probably the best change we could make on the weekend would be simply to move the paramedic into a fly car and just bring on 1 extra EMT, because I don't think adding a full second ALS car, I don't think we're going to be able to cover the cost of that with the amount of mutual aid calls we would cover. But I definitely do see that by having 2 BLS units, that paramedic could stay available in town, and obviously be available if there was a medic level call, or to jump on even with one of our mutual aid partners. And other than one town who I'm still trying to convince to agree to it, we have bundle billing with everybody else. And what that means is, if my medic in the fly car jumps on with them, we are guaranteed income for that call because we bundle bill. So they will just pay us a fee for the use of our medic, regardless of anything. So it's kind of a good option for us. So I'm going to stop sharing. And I'll go back in order, but I just wanted to just briefly touch on it. So that, that's what I'm kind of looking at and hoping to get us to, if not this fiscal year, over the next, over the course of the next 18 months. I would be pushing a lot harder if it hadn't been such a tough year for us in terms of call volume and revenue. So that's that. So that was the Chief's report, which includes the COVID-19 report. So we can move right along when we have a little drink. Because I'm talking too much. Sorry.
That's okay.
I'm trying to go really fast so I don't keep you too long.
No. Listen.
All right.
Meeting's a meeting.
So
anything else that we have to talk about in the old business?
yes, the budget discussion.
That's an old one.
That's old business, and it's going to be really short, but so sweet. So sweet. So the Board of Finance voted on the budget this week. Last week. Yes, the Board of Finance, and they voted unanimously to restore our budget to what we originally requested, both for the staffing and the equipment. So super excited. I thank you guys for your investment in that. And now it goes to the town council, who, just for the record, they can reduce it back again. But at least it all went up, because the town council can't bring it back up. So our only shot to get it back up was the Board of Finance, and the fact that it was unanimous, I think, speaks volumes. So super excited, yay. There was a lot of squealing from behind the screen here. So, that's all business.
Okay. Anything else? Anybody have any questions? When is the next meeting now? Is it not the council?
Well, the
Board of
town
Finance,
council?
when is the next meeting?
I'm not sure. I could check real quick on the town website. Town council finance hearing. I feel like the dates were all skewed once it got delayed, but if I can search for it. I'll keep looking whilst we go on. When I find it, I'll let you know.
Okay. Next thing we have is new business. We have any other old business that we need to cover? Okay, in new business, EMS week, discussion and request for funds to support staff appreciation efforts.
All righty, so EMS week this week, coming up soon. It's called This is EMS, helping our communities, I think is the phrase. I just looked it up today. You know, kind of focusing on the efforts that we've done to date as being community health partners. Here, I have it here. This is EMS, caring for our communities. That's the phrase. All right, so we are very excited. We are looking forward to, you know, kicking it off with EMS Open House, which we are having on the 15th of May from 10 a.m. to 2 p.m. outdoors with as much social distancing as we can possibly encourage, spreading everyone out in the Middlebrook parking area as well as our own bays. So that's how we're kicking it off. We're going to be offering hands-only CPR and some, you know, a few activities that we normally do. We've invited some of our community partners to attend, and we're waiting on hearing back from some of them, but hopefully they'll be there. So I encourage you all to save the date, share it with your family, and bring them down for a fun, safe outdoor event. After that, we are having our EMS Week picnic. You will be receiving an invitation shortly, which is from 5 to 7 at Unity Pavilion on the 19th of May. We have the taco truck coming down, and we will be presenting our 2020 calendar year 2020 Trumbull EMS Awards at that event. We had held off just waiting to see if we could get away with some sort of a staff appreciation holiday party, but I just felt that just having anything indoors was not a good option. We can wait till next year. So what we're doing is just basically combining the EMS family picnic with staff appreciation dinner. And so we will be using the funds for the staff dinner to pay for the meal, the taco truck that night, and associated costs. I was hoping to request some authorization to spend some special agency funds on our EMS week gifts. I am waiting on a formal quote on either a shirt or a hoodie for our members. We were going to put that out similar in a way that we did it last year, where we would ask people to sign up with their size. So we will only order enough for the people that are going to be picking them up, because historically I found we just kept ordering 100 shirts and then we had 20 or 30 left over, and they're expensive. You know, it adds up. So this time we'll do it the same way. Everybody who deserves a shirt gets a shirt, you know, but that way it's just a little bit more cost effective. So I'm hoping to, you know, it's a little vague, and I'm more than happy to send final numbers, but you know, ask you guys to approve up to $1,500 towards an appreciation gift for our EMS providers, using funds in our special agency, of which they are plentiful. I went into Munis today to check. Still plentiful.
Motion.
What EMS providers, what are you talking about? The police and the fire?
No, for our guys.
Oh, okay.
For our guys.
Our team.
Yeah, for our
Okay.
team. I have, I don't know if you can see it here. This is a potential design for a t-shirt or a hoodie,
nice.
depending on the cost. Hoodies just tend to be, they can really knock the price up from, you know, closer to $20 which is reasonable, but still a lot for 70 people.
Right.
But I think it's a really nice shirt. And then we have funds in our other account that we can use to get additional things that we're looking at. So
Lee, you know there is a pavilion at Unity. Did you get a chance to go over there?
I haven't been down yet, no.
Okay, down the bottom of the hill, it's an open pavilion just like we have over at Twin Brooks.
Oh, perfect. Perfect.
I don't think there are tables in there. I think you just sit around, but if people have to bring chairs and stuff.
Yeah, I was going to take Kate down there later this week, and we can always see, because we have a few very easy fold-up tables that we can bring along with some fold-up chairs too.
Yeah.
So if there's nothing there, we'll probably end up doing that.
Right. But yeah, it's down there. And
Um,
you can drive right down there, like the ambulances, but they probably should stay on top of the hill, and just the people that have to need a car down there wouldn't have to go down.
yeah,
Other than
absolutely.
that, I don't think you have to go down. Now, $1,500, is that enough?
Well, I don't know yet, because they didn't get back to me with the quotes, is my most honest answer. Like, I kind of guessed at like $20 per person. And I
Is
looked,
this-
I looked at what was
costs more
spent
than
last
that.
year.
It's a shirt and a hoodie, or one
No,
of the
no,
other?
it's one of either.
Okay.
But if you do the hoodie, that's got to be more than $20 a piece.
Yeah, most likely it would be.
I'd say more like 30 or 40, wouldn't you?
Hoodies are nice though.
Yeah, oh, they're very nice.
Yeah, I mean, it would probably be closer to 35 or something, I would imagine,
Mm-hmm.
which would really bring us up by like another 1,000 to 2,500.
That's right.
Hey, Lee, who are you using for the printing?
I'm getting quotes right now from a bunch of different ones. So from On Time, Minuteman Press, and one new vendor that we just got. I'm pinning my hopes on them, because they're the ones who just gave us our new Temps Pace t-shirts, and they were much more cost effective than we've used historically. So I'm hoping they're coming back with a better quote.
Okay,
Do we
can it be anybody to quote, or does it have to be town approved?
Well, it has to be a town approved vendor.
Okay.
Certainly if it's a new vendor that comes in, Kate and I can put in for a new vendor request.
So when you go to get the quote, anybody can give you a quote. We just can't buy from them unless they're a vendor in the system.
Okay.
And that's easy. They fill out a form, they fill out a W-9, and then it gets sent to finance and they get put in.
Okay.
But they don't have to be a vendor for us to get a quote from them.
Okay, that's good to know, because just sidebar, my wife's very good friend owns soccer and rugby imports, and they just opened a huge printing press, whatever you want to call it, for the doing all the apparel, and it couldn't hurt to get a quote, and she's local in town here, so
Oh yeah, absolutely. I mean, if you shoot me an email with a name,
Yeah,
we can send
absolutely.
it out. Well, we're going to continue working on this tomorrow, so we're just finalizing design and stuff. And
Yeah, I'll send you her contact info when we wrap up the meeting, and if you want to reach out to her, I'm sure she could at least give you a number.
Yeah, and that's what we do. I mean, we follow the purchasing policies. We just request the numbers. We don't tell anyone what the numbers are, what we're looking for, and they send us back, and then we can make a decision. And certainly, if it's cost effective, it's easy enough. If you ever want to inspire the town to get a new vendor, show them the lowest bid. And
Yes.
they haven't said no yet.
I will certainly relay that. Yes, absolutely.
And then as long as they're reliable, I mean, that's the other thing, just because it's a short turnaround time. So we're always very honest with them, when we're looking to get a buy and if they're able to or not. Every year I say I'm going to get better about planning this in January, and I don't know. Next year.
You had a few things to do.
Yeah, every time I remember it, I feel like I'm remembering it 1 month too late.
All right, getting back to the price of these. Now we have that big special agency account, don't we?
You do. There's currently $49,000 of funds available in it after we bought the tablets.
Now, do we have any smaller accounts that are available, or is that the only one now?
No, that's the only one. We consult with it now.
How's the copier working?
Not delivered yet.
Oh,
Coming
I
this
had
week.
the same question.
In theory, it's working great.
it's working amazing. It's not costing us a thing yet.
Yeah.
No, not at all. Right.
I'd kind of like, everyone gets a shirt. I mean, I know it's more expensive, but, I think these guys have been through a ton. And I mean, I don't know, looking at it, I'm assuming it would be the same quality, whether it's a good shirt or a good hoodie. And it just seems that, a hoodie is more substance, to kind of show you that, it's worthwhile. So even if, I mean, the fact that we have, not that I want to spend $49,000 out of the special agency fund, but for another $1,000, I think that's probably a better pat on the back for everyone that's put in so much time and so much work. And I mean, that's my thought.
Joel,
I
I
agree.
fully agree. So it's the right thing to do. I would even
Right.
say an additional $2,000. I mean,
Yep.
stay warm for God's sakes.
Yeah.
You know.
No, I agree. So that's, did you say you were going to be doing something else with the?
Yeah, so we also put together an estimate for lunch bags, custom lunch bags, coolers. So I was going to be getting them that as well, but I'm going to be using our community relations, public relations fund for that because last year they approved us to use that account for, I believe it was either the challenge coin or the EMS Week t-shirt, but they approved the use for an EMS Week gift. So since they historically have, there's no reason for them not to. And because once again, we did not need to use that money this year as much as we normally would have, I'd like to spend those funds. So I thought I would try to split it up again. This is what we did last year. We split it up. We did one gift coming out of my line item for public relations and one gift that essentially the commission approved from special agency.
Great.
Now that's over and above the dinner that you're going to have. Did you allot that money in there too, or no?
Yes, so we have funded the dinner through our, we have an account called program expenses. And so it's a joke between me and Kate because I keep mixing it up with program supplies and they're very different. But program expenses, which is essentially to cover our staff appreciation dinner and awards. So just for this year, I felt comfortable using that for the picnic because we're just going to give that money back because they'll only approve it for a staff appreciation meal and awards. So usually we would come to special agency and the EMS Association to come together to help us with the picnic. But this year, I think we can just use the holiday dinner fund because we really can't spend it anywhere else.
Use it up.
Yep.
So you need a motion now for the shirts then, obviously.
Yes.
Okay, so, I mean, we can put a motion together that we would approve using up to $2,500, $3,000, no, what'd you say, 7,000?
What's the
Let's
ask?
play it safe. Let's play it safe.
5,000? I thought the ask was 5,000.
No, she was asking for
1,500.
Oh, okay. I guess
I
I
was
just,
just proving that I try to be frugal and hoping that you
Yeah,
guys
we
would step
appreciate
in
it.
and,
I mean, there are places to be frugal and places not to be frugal. So
I agree.
why don't we
2021,
approve?
not the year to be frugal.
Right. Why don't we approve up to $3,000? You think that's
Yeah.
enough to cover
Yes.
out of the special agency fund in order to purchase hoodies? Thames Trumbull EMS hoodies.
Awesome.
Second.
I'll second it.
Any discussion on it? I know we've been discussing it, but any discussion?
Sounds good.
I think it's a great idea. All right, let's take the motion. Will everybody in favor of the motion say aye?
Aye.
Aye. Anybody opposed? Anybody want to abstain? Motion carries. Okay, Lee, you got money.
Thank
Go buy
you.
your
You guys
shirt.
are awesome.
What other commission gives you twice what you're asking for? Jeez.
I'm telling you. See, can I just say that the other day I was in a meeting with the superintendent of schools to discuss traffic bus mass casualty accident planning, and there was some flowers. They're over there right now, and a balloon on my desk. And he was like, "Oh, who sent you flowers?" And I said, "My EMS commission." And he was like, "Wow, your EMS commission is very supportive." And I
Well,
launched
go
into
to
a whole
bed.
thing. So I very much appreciate the support, and our guys appreciate it. They really do notice. They
Good.
um,
They deserve it. You deserve it.
That's
know?
right.
appreciate it.
Sure.
So
Absolutely sure.
yeah, one town, one team.
Do we have to
Absolutely.
set a date now too?
What?
Do we have to send Kate flowers? I mean, you got flowers. Do we have to send?
Definitely,
I don't.
definitely,
No.
definitely. And I have to send
sending Kate to Disney
Bill.
World? No.
All right, so that's that. Deployment pattern we handled and we skipped out of line. EMSI sponsorship program. So this is an idea that I've come up with. I just want to float the idea and you guys can tell me what you think. We're trying to build out our faculty now to help teach the EMT class. We're still very picky. It's not a very popular thing, but we don't just let anybody teach because it's really, you need the right people. But what I do find is I have a couple of really great instructors, but they are not certified Connecticut State EMS instructors. And what that means is they cannot teach unless they have a certified EMSI in the building. So I'm trying to get more people to take that class because otherwise myself, either I have to be in the building, which is fine in the summer class, but in the winter class, not so fine because it's always at night. Or I have to pay one of our lead instructors $30 an hour to just be sitting there so the other guys can teach. So the reason most people haven't taken the class is historically it used to be a very time-consuming and expensive program. I know the program I cost was certainly over close to 2,000, and I gave up a zillion hours, it felt like, of my weekends. But Sonny Ruskin, our supervisor, he found a program that's online. It's called, I thought I had it here. Where do I have it? Somewhere here. It is called the emssuccess.org. And they offer an online version of this program, which I was genuinely blindsided to find that the Connecticut State of OEMS actually accepts this training program because the other programs are so, the hours are so long. So Sonny ended up, he was our first guinea pig because it was part of his job requirement to be an MSI. So he took the program at his own expense, and it cost him $250. And he then did his 24 hours of required Connecticut State student instruction with us, which was very easy. So, and he's now an EMSI, or his license number is pending. But I was thinking that possibly we would like to sponsor, one or two of our stronger instructors that we've been using over the past couple of years, because I think they'd be more willing to take the class because it is online and a lot more flexible in terms of the hours that they have to commit. So I was thinking of drawing up, really drawing up an agreement or contract that says we would pay for them, but they, in return, have to do all of their student teaching with us, which they can usually knock out in one EMT class, if not, half of an EMT class, and then commit to teaching for us a certain number of hours per academic program or per year. You can't hold people to everything. It's all, people have schedules and lives, but and once they finish their student teaching, I wouldn't be expecting them to teach for us for free. It's simply that they're making themselves available to my program, so that we have that high quality instruction with people that we trust. So I was thinking this would be a great way to spend money. It's $250 a person. So if we could sponsor, any amount up to like $1,000, that's four people. I can do math, I promise. Start with four instructors, see how it works, make sure that, we're starting to see them really commit to our program. I'm not just going to hand out four. I'm really going to, people are going to have to apply, and I know our team fairly well. Initially it's going to be going to the people that I know are dedicated to Trumbull EMS and wanting to be here. And I just thought that might be another great way to invest in our education team. The other thing that I find is helpful is almost giving it out as a reward. So for example, one of our young students, Tim Farrelly, he was in our summer program, he graduated, he went through our FTO program at warp speed, and now he volunteers for us at least, I'm not sure, but probably 8 hours a week minimum, either on the road as an EMT or at one of our clinics. And he has been offering to come in and teach practicals with us for free. And he's a great person to do it, right? Because he just went through the National Registry. He's on top of it. He's a great kid. for someone like him, we were talking about things where we're not paying him because he's a volunteer, and it's a very wiggly line between not being allowed to pay and volunteer for us. That Tom McCarthy has really issued the smackdown on that. But giving someone like him a reward, like congratulations, you did all of this, we'd like to pay for you to get your EMSI, or we'd like to send you to the EMS Expo and pay for your 2 days of classes. I thought that might be a great way, to invest in some of our volunteers and team members and still reap the benefits, because they're bringing that knowledge and expertise back to our organization and continuing to work with us.
It's a good idea.
Good idea.
Yeah, it's great.
Yep.
That's definitely one way to bring the youth in too.
Yep. Class is only as good as the instructor. So.
Yeah, it really is. It really is. And we do a lot of evaluation. We give the guys feedback. Sometimes it's just about them learning how to be an educator. So we watch, we ask for the students to give feedback, and then we work with them. And occasionally, we ask them to do better, but they either do because they just aren't educators, but we give them some tools and then they become better, or we won't let them teach again. It works well. I think they take a lot of pride in the class ultimately at the end of the day.
Lee, how often do these classes run? Oh, it's online, so it could be any time.
Yeah, these classes, I believe, are fairly frequent. And I can do a little bit more research, but I think because they're online, they are anytime.
It's worth taking advantage of now, because with the pandemic, a lot of stuff is going to online, and they're kind of softening the requirements. Yeah. I know the National Registry just did that recently for refreshers, where you can use distributive credits for all your hours to recertify, which is stopping after this run. So they can do that from this point forward. So it's worth taking advantage of it.
I agree. Although thank God they're stopping that, because I can't get anyone to come to an in-person lecture anymore because they're all just doing their online stuff.
I get back to that. It really does.
It's not. I think sometimes an online class is good, but often it's not.
No.
You have to be a very motivated student to
Plus,
get.
you need hands-on too. It's just.
So yeah, I would like to. Yeah, I think you're right. I think we should try to send them whilst we can still get away with them accepting that online option.
And it's a way of paying the volunteer without paying them.
Yeah,
Right.
Exactly.
And still reaping the benefit of them coming back and working for us.
Absolutely.
Well, does anybody want to make a motion to fund this program for us?
I can make the motion. Is it coming out of the special agency?
Yeah, and I think ultimately, I don't think it needs to be a dollar amount, but simply saying that, much like with the EMT programs and stuff, we tend to just use the special agency as approved. Like if you wanted to say that we're eligible to do that, but I need to provide you with a semi-annual report of how many we've done, because if I felt like it was going to be a large amount, I'd come back and discuss it with you. But I think it would just be, if we look at it just being a continuous thing of, say 2 to 4 every 6 months, something along those lines that could work, or we can put a dollar amount. It's up to you guys.
Well, if we put a dollar amount, that would, give her leeway to do 1 to 4, let's say.
Do you anticipate having more than 4, or should we do a little, maybe do like, I said, $250 per student, so maybe do up to 6 students?
I think if we do up to 6 students annually, I don't anticipate even being that high, because I think it has to be the right person that we want to do this, but that could be,
Well, we can cap it at that, and if you use 4, use 4. If you use 6, use 6. But I think there may have to be, in this situation, some sort of dollar amount on it.
Okay.
So, and you can always come back if you need it more.
Exactly. So we can just do that.
1,500 would cover up to 6 students, right?
Yeah.
So I could make a motion to approve up to 1,500 out of special agency for the online training course.
I'll second it.
Okay, anybody have any discussion or want to make comments about it? I think it's a great idea.
We do them backwards. We discuss it first, and then.
I know, we do.
Always backwards.
We have to be doing this right.
Different.
Yeah. All right, we have a motion on the floor. Everybody's all set with it?
Yep.
Okay, let's vote on it. Where's Shay? We need Shay. Uh-oh.
Says he's there. He's just not got his audio on.
Shay? Mhm.
Oh, Shay.
Uh-oh. I can't count as the fourth person, huh?
No.
No. Shay, where are you?
Anyone have his number? Just to.
Lee, do you have Shay's number?
I do.
Want to give him a quick holler?
Another positive case at Middlebrook.
You know what's nice about doing that, having someone else become an ALS instructors, it will have everybody in-house, so we can run classes anytime we need to or want to.
We control it ourselves.
We control it, that's correct.
Plus the quality, that's the main part. I've seen classes where you're just thrown together and they're like, I'll let him go. He kind of knows what he's talking about, you know.
No.
Yeah.
It's not how it works.
No, it's really not, and it's not the type of education experience we want to give our students. You know, we're really, really proud of it, like here that, you know, I remember being, you know, hired to teach for other programs, and I would say, oh, can you send me the slides? Okay, I'm going to review, I'm going to put something together, and they'd be like, nope, it'll just be there. And, you know, I would just show up and teach a lesson, and in my mind,
read off the slide.
You know, that's just, anyone can read off the slides. These guys have a learning management platform as part of the hybrid anyway. They can do their own reading. You know, and it's communication, like each class is different. So it's having the type of instructor that whilst they might be teaching respiratory, they're acknowledging that, that they saw a deficit, looks like the people didn't grasp the previous lesson, and reaching out to the lead instructor and saying, you know, it looks like you might need to review that. You know, helping us put together exams so you know them and you know the material that you're teaching towards.
More practical.
Yeah.
Yep.
So
I had a fight teaching in an ACLS class once. I had dynamic EKGs. Wait, this has got to be 20 plus years ago. And we were doing doctors also at Phelps Memorial Hospital. And what happened is if you failed under a certain amount of stations, you got to retake them. But you retook them with a different instructor.
And we're just wondering.
And at the end, you'd all sit there around this huge table and go, all right, how'd this person do? How'd that person do?
Please give me a call at 203.
There was this one doctor that
339
was terrible. I like failed.
Thank you.
And they got mad at me because I ended up failing and it was not just doctors, medics. I probably failed 30% of the people that came through the class, through my station. But they retested with this other doctor. And so we came to a few people and they're like, oh, Joel, he failed at your station. And how do you do? Oh, he was doing better. I said, all right, that guy he kind of knew what he was doing. He was maybe off by one. No, they got to this guy. And I said, listen, don't even ask him. I said, there's no way this guy did any better. So that the doc says, you know, with a little help, he got through them. And the smoke was coming out of my ears. And this doc, who was a good buddy of mine, leans over and goes, well, I hope when your mother comes into the ER that you're there so that you can help him through to decide what arrhythmia he's in. And I just sat back and said, that's perfect. And so the lead doctor was Dr. Nigro, who ran the ER there, said, no, he fails. So, yeah, you got to have people that are just not letting people shoo their way in. So.
Absolutely. All right, I said to Shay, could you pop back on for a quick vote? He said, I'm online, but no camera. I said that they are asking for a vote to approve $1,500 for up to 6 students to take the EMS instructor class. And he said, I vote yes.
Works for me.
So does that work for everybody?
Good, because I just called him too, but he had no answer. So all right, so all in favor, say aye. Aye. Anybody opposed or abstain? Okay, Lee, you got reins on that one too. Boy, we're spitting out that money tonight.
Yeah.
It's all right. And we don't want to. We want to use it so we don't lose it.
Yeah. True.
All right,
There's a lot of
EMS, EMT supervisor update. I think that's our last thing on our agenda.
Yep, and I covered that in the chief's report.
Right.
Okay, so we're good with that.
Excellent.
All right, does anybody have any comments, questions, anything you want to add to the meeting?
Just
Nope.
as always, that Lee's doing an amazing job.
Absolutely.
And as always, thank you for your support. Truly, my husband Brian even was saying, it was like, it's not like that at my work. People are just so like, engaged and supportive, and I'm very, very grateful because it isn't normal. I think not everybody has this much support. So
Yeah, but we also don't, most places don't have a good chief like we have. So,
That's in Connecticut, as far as I'm concerned.
that's right, for sure. Okay, anybody want to make a motion to adjourn the meeting?
Sure. I make a motion to adjourn.
I second.
All right, motion to adjourn the meeting. Everybody in favor, say aye.
Aye.
Aye. Bye, everybody. Stay safe,
Stay
and
safe,
we'll see
yes.
you in a couple of weeks.
Hi guys, we'll see you at EMS week.
Oh, yes,
Thank you.
May 15th.
May 15th and 19th. I'll send you invites.
Yep, great.
Very good.
Thank you
Take
guys.
care.
Thanks, Global TV and Bill.
Yep.
All righty. Take
Okay.
care. Thank you, Bill. Thank you, Kate. Thank you, other Kate.
Yeah.
All the Kate.